Time flies, people, and so it happens that it has been 4 months since my last scans and health update. Let me bring back some key dates in my journey. In April 23, I was diagnosed with squamous cell carcinoma stage 3, metastasized in the lymph nodes of the groin area. The suggested treatment protocol was to surgically remove between 20 to 40 organs, chemo, and radiotherapy. After careful consideration and research, I decided to pass on all that. I did none of it. Instead, I started metabolic treatment reinforced with repurposed medication and supplements on June 1st, 2023. If you are new to the channel, I documented in videos what I did, why I did it, and the science backing my approach. For the next 17 weeks, I had not seen a doctor. In mid-October 23, I presented myself in the hospital where I got a PET scan, a CT scan, an ultrasound, and a clinical examination. I was consequently declared in complete remission and NED, no evidence of disease. No trace of cancer was found in my body. The team of doctors advised no further treatment. I got the best possible outcome. 4 months ago, I won round 1. However, since this was my 4th cancer and I had dealt with recurrence in the past, I decided to stay on my protocol. I kept fasting, the ketogenic diet, the supplements, and the exercise. I cycled off some supplements temporarily to avoid toxicity buildup and reduced the amount of key supplements by 25%. I went from 40 to 30 pills per day. I kept my 21-day cycles, but I lowered the ratio of fasting eating days from 417 to 318. This allowed me to keep the weight on much easier while ensuring autophagy kept kicking in. I continued weighing all my food intake and tracking it in my food app. I now almost have 1 year's worth of data: calories, fat, protein, carbs, micronutrients, the complete detail. If you ask me how many milligrams of magnesium I had 155 days ago, I will tell you. The graph shows my body weight evolution over the last 8 months. The vertical axis is the weight in kilograms, the horizontal axis is the timeline. White areas are eating days, green areas are water fasting days. You see the steep weight drops on fasting days, but mainly I always manage to return to my base weight of 70 kilograms, 155 pounds. Over the entire period, fasting days included, my average calorie consumption resulted in plus 185 calories, a slight calorie surplus. Now, for those wizards interested in the topic, here is something remarkable. If you look in detail at the first half of the graph, linear regression of the data between June and October 23 shows a downsloping trend towards October. The second half of the graph between October 23 and February 24 shows a clear upsloping trend. With calorie intake and physical activity the same, how can weight go up or down over months? It took me some time to figure it out. Speculate in the comments. Anyway, on February 15th, 24, I spent all day in hospital. I went from one scan to another, clinical examination, and finally the consultation with the leading specialist. I want to give a special warm-hearted shout out to the doctors in that hospital. Although I did not do or follow any of their treatments, they still want to do my follow-ups, interpret the scans, and analyze my current medical status. She also went the extra mile to get the images of the scans taken in the morning and presented me with the results. If you are a cancer patient, you know how much waiting is involved, and usually patients have to come back 1 week later to get scan results discussed. The doctor came to the point straight away. All 3 scans were clear, and the clinical examination showed nothing abnormal. I am still in remission, with no evidence of disease. I won round 2. Thank you for watching. Consider giving the video a like and subscribe for future videos.